As direct care staff at Emend Healthcare, you have a unique vantage point. You spend more hours with clients than anyone else on the treatment team. You are there for the meals, group activities, and the quiet hours. Your role is highly specific. You are not a doctor or a nurse. You do not diagnose conditions, you never adjust a medication dose, and you never tell a client their medication is bad. You leave the prescribing to the clinicians. However, the clients in your care take powerful psychiatric medications, antipsychotics, antidepressants, and mood stabilizers. These drugs treat severe symptoms, but they carry risks. If subtle physical or behavioral side effects go unnoticed, clients can suffer permanent, irreversible damage. To manage this risk, Emend Healthcare relies on a strict protocol for all direct care staff. You have exactly 3 jobs when it comes to medications: observe, document, and report. By strictly following this 3-step protocol, your routine daily interactions become the facility's most vital safety net. You are the eyes and ears that catch complications before they escalate. Let's look at what observation actually means in practice. Imagine a client who has been taking Haldol, a first-generation antipsychotic, for 8 months. During lunch, you notice he is repeatedly smacking his lips and darting his tongue in and out of his mouth. A rookie staff member might write this off as a quirky, harmless habit. That assumption is dangerous. These involuntary facial movements are textbook signs of tardive dyskinesia, or TD. It is a slow-onset side effect caused by long-term exposure to antipsychotic medications. This chart maps 4 extrapyramidal symptoms, or EPS: dystonia's sudden muscle contractions, akathisia's intense restlessness, Parkinsonism's tremors, and tardive dyskinesia's repetitive movements.
You track their AIMS exam due dates on a timeline, at baseline, 6 months for high risk, and 12 months standard. In our lunchroom scenario, your exact action is to document objective facts. Write down the body part, the specific movement, and whether the client seemed aware of it. Do not attempt to diagnose it as TD in your notes. Simply write what you saw and report it to your supervisor and the prescriber. Tardive dyskinesia can become permanent if it progresses. Catching these micro-movements early and reporting them immediately gives the prescriber time to adjust the dose or introduce an inhibitor, stopping the physical damage. Consider another scenario. A client started a new second-generation antipsychotic 5 days ago. Today, she is pacing frantically, completely unable to sit still, and tells you she feels like she is going to jump out of her skin. This is akathisia. Mistakenly documenting this behavior as bad anxiety or agitation sends the wrong message to the medical team. If the prescriber thinks the client is simply anxious, they might order a sedative, ignoring the actual cause, an adverse reaction to the new medication. This logic tree tracks secondary risks. Left, monitor second-generation antipsychotics for metabolic changes, like weight and blood sugar. Right, antidepressants carry an FDA black box warning for suicidal thinking in clients under 25, requiring mandatory suicide screening. Accurate, objective language in your documentation is the defense against both immediate misdiagnoses like akathisia and long-term health failures like metabolic syndrome. Describe exactly what you see, and the treatment team can respond with the right medical solution. Some reactions require immediate escalation. If a client on an antipsychotic develops a 103-degree fever, profuse sweating, and lead pipe rigidity, standard reporting no longer applies. Those are the cardinal signs of neuroleptic malignant syndrome, or NMS. It is fatal in up to 20% of cases. You call 911 immediately, hold the next dose of the medication, and do not wait to see if more symptoms develop. This 4-quadrant dashboard compares NMS with 3 other emergencies. Serotonin syndrome causes sudden confusion and rapid heart rate. Lithium toxicity's narrow window triggers severe tremors and vomiting. Finally, airway dystonia causes sustained neck muscle contractions that physically threaten breathing. When faced with NMS, serotonin syndrome, lithium toxicity, or airway dystonia, you bypass all standard protocols. Dialing 911 is the only correct action. Protect your clients by knowing the risks attached to their medication classes. Understand the high alert profiles of antipsychotics, antidepressants, lithium, and controlled substances. Keep a constant watch for slow-moving threats. A new tremor,
rapid weight gain, or a repetitive facial tic are medical events that require intervention. Document every observation clearly in the electronic medical record. Rely on objective facts and direct client quotes to paint an accurate picture for the clinicians. You do not need to prescribe or diagnose to practice great healthcare. By adhering strictly to the rules of observation, you directly protect clients from harm and ensure they can safely focus on their recovery. Observe carefully, document precisely, and report early. You are ready to step onto the floor as a vital part of the Emend healthcare team.